Okay, welcome to Stuff About Stuff, where I talk about stuff about stuff. And on today's episode, we're going to be talking about chiropractics. Now, not just any chiropractics. This is a special kind of method of chiropractics. It's called the Y strap, where they put the strap around your neck, you yank it, and release all your spine. Now, apparently, releasing all the parts of your spine will allow nutrients to get into it. So we spend all our time obviously standing up, and the spine gets compressed, so this is like a decompression. Now, it's not a very popular method. A lot of people are scared of it. I've had it done once before with the towel method, where they put a towel on your neck and yank that, but this is different and super exciting because there's not many places in the world that do it. I happen to be in North Carolina, right on the border, which is near South Carolina, Greenville, which is where a Dr. Joseph Cipriano actually does it. So we're heading on down there and he's going to be doing it. And to top it all off, a friend of ours has given us a cool little Z4 BMW that we're going to be taking. So yeah, let's get this roof up and let's go to Greenville. No better way to get around town. And then a cabriolet. Let's do it. Okay, we're in the elevator and I'm not gonna lie and say that I'm not a little bit nervous about having my neck yanked. Oh yeah! But I am excited. Yes, hello. Good day. Nice to meet you too.
Hello.
It's my wife Veronica.
Nice to meet you.
Nice to meet you.
Thanks for being able to allow us to film it.
Of course, of course. Where are you guys coming from?
We're staying in Tryon.
Okay.
But we're from Australia, from Melbourne.
Nice.
Yeah, and I've seen a ton of your videos, and obviously, and then was looking at one of your videos when I was on my way to North Carolina. I was like, oh, he's in North Carolina. You're kidding me. That's great. So yeah, so here I am. So
Perfect.
Thanks.
Love it, love it. Man.
There's not many places in the world that do this move, you know, like I think it's illegal in Australia.
You know, the thing is, so the Y strap itself it was invented back in the mid 80s. It was a Dr. Earl Pettibon that was the inventor of the Y strap. Now, even me throughout chiropractic school, never learned the technique, never knew anything about it. It wasn't until the first doc that I worked for had a Y strap in his office, and you know, right when you're out of college and everything, you know, I didn't, really question him or anything about it. I watched him do it on a few patients. I'm like, oh my gosh, what is he doing? And then finally one day I was like, all right, well,
I'll give it a go.
yeah, and he's like, oh, you've never been Y-strapped? I'm like, I've never even heard of this.
Yeah.
First time when he laid me back, did the adjustment, it was like, I laid there for a second, I was like, what in the world just happened? This was like the best adjustment I've ever had in my entire life. And then that was when I was like, all right, well now I gotta start researching this. What is going on? What, like,
how does it work?
Exactly. So I'm, going back through, re-looking at like even more back of all the anatomy, things like that. And I'm like, oh my gosh, but you get up and you're like, just after that one adjustment, you're like, this is amazing.
Yeah.
You know, so.
What is the science behind it roughly? Is there a science behind it, or is it just simply a matter of elongating the spine and letting air in there?
Yes and no in both. So what's actually happening, so on the, here, I'll kind of just pull up the spine here.
Pretty awesome, thanks.
So what's actually happening happens over time and with movements, you know, if you're bending, you know, flexing, extending, you know, lateral flexion, rotation, what can happen is the little dentate ligament inside actually start pulling and they get almost like stuck, like a, you know, any other ligament in the body can happen. One of those feelings where like, you know, when you're like, but it's nothing you can like get and whatnot, exactly. And then over time you just...
I think everybody has that.
Correct, and then you almost just learn to live with it. What this is doing when you're doing that adjustment, that decompression with the Y strap, it's actually pulling out all the kinks on that dentate ligament. So it's pulling out the kinks in the spinal canal. Yeah, right. So it lets the spinal cord actually sit freely with no tension getting pulled at it. Whereas your traditional chiropractic adjustments are all focused on as the nerve is exiting the spine. This is more internally.
Cool.
Is really the only difference after going through and just learning and researching all of it. But yeah, you know, a lot of people.
There's a doctor on YouTube who does a video, a surgeon. He said he's never done it before, but he explains that one of the theories is it separates it and allows nutrients to get into it, which I've never had that theory.
So when any kind of like a decompression, so what's happening when you're pulling also the vertebra and you're pulling everything apart. So the discs itself have no way of actually getting nutrients into it. So it's usually the disc, you know, just by little movements like this, it'll, you know, starts, you know, bringing nutrients in just by movement and suction in here. But with this, because it's more of a full decompression, it will actually bring nutrients into multiple levels at one time.
Do they get in while you do it, or does it happen after you do it and now there's space so it gets in as a slow ongoing process?
It's a little of both. You'll feel it initially, but I'll have patients even the next morning waking up like, oh my gosh, I feel even better the following morning than I did, you know, directly after.
Well, I have had this done by a doctor that in Australia it's actually illegal, but I did have a doctor do it somewhere. And I've had problems all my life in my lower back, and they're actually gone. So it worked, and it didn't, like you said, it didn't happen overnight. It happened over about 2 months, and I didn't even realize. I was like, actually, my back's gone, pain's gone completely. So it takes some time for it to the pinched nerves or the pinched muscles or whatever it is to actually the nerve part of the nervous system to actually decrease. So I'm assuming it gets a crease in it, like any crease in a piece of clothing, and then it takes some time to uncrease.
But yeah, I mean, the technique itself, I mean, like it's been around, it's just not that widely
used.
Yeah, popular. And for me, it was, you know, when you feel it done and you get it done, you're like, oh my gosh, like that is what I've needed.
That's what you feel like when you watch it. A lot of people watch it and go, that's what I needed, or they get a little bit scared. So you know, a bit of both.
What are you now?
I'm a little bit nervous, but you know, I have faith.
Okay, let's see it.
Let's have a go, yeah. Perfect. Thanks. What do you want me to do?
Okay.
Take the cap off maybe and the
scarf.
The scarf, yeah. Mask, whatever.
Okay.
Alright, what do you want me to do?
Let me have you lay face down on the table.
Face down?
Yep.
Just, do you want to give me the microphone?
Just the top bit?
Yeah, I'll hold it. Thanks. Sorry, doctor, whenever you're ready.
Yeah, for me, so I always want to scan the body, just kind of see what I'm looking at here. So I'll go through. Yeah, good. I'll go through, I'll check the leg length. As you can tell, even going through, honestly, not much difference at all. When you really look, maybe about a millimeter pulling short on the right, but it's not bad, because I'll get some patients that come in and it'll be almost like a, a huge difference. So what I'm looking at here is not bad at all.
Uh-huh.
But these are all little things that I'm looking at. So I'm checking the labeling. I'm looking for any kind of dysymmetry in the body. So I'll get down, I'll check the hips. I want to make sure the hips are level. Also looking up the entire spine.
Uh-huh.
I'll go through, I'm looking for any tight, taut muscles, any high musculature on one side compared to the other. And then even as I'm palpating, checking the spine, let me know if there's any pain or tenderness, okay?
Uh-huh. Pretty good.
Good. Okay.
I am in one degree. I'm sort of at one of the best stages I've been at physically, and I've been in pain for a long time. It's just I've done a lot of work the last 2 years, and I'm feeling a lot better than usual.
Good. Well, that's always a good thing. Okay. So I always start off, I just want to relax the body first. So I'm going to start with the massage gun, and then we'll start with the adjustment after. So I'm going to start right up top here.
Mm-hmm. Push. Nice one. Push.
There we go.
That was huge.
Take a deep breath in and out. One more time, deep breath in and out.
It does feel turning more toward the lower back, middle.
Okay. Let me have you sit up on the table for me,
Uh-huh.
and then I want you to bring one leg
On each side?
Bring one arm, bring it up over that shoulder. Bring the other arm up over here for me.
Like that?
Yes.
Perfect.
I'm gonna rotate you like this. Look over the shoulder.
My hips. Never felt a crack like that. Oh yeah. That was awesome.
You can relax your hips here.
Thanks.
Okay. Let me have you lay face down again on the table for me. So from here, just gonna lightly stabilize on the sacrum. Raise your right leg up for me. Any pain with that?
No.
Good. And relax. Compare it to your left side for me. Any pain with that?
No, not at all.
Good. Let me check that leg length. Still looking good. I'm gonna let go. It pulls in still just that little millimeter. I mean, it's not much. off at all. So what I'm going to have you do, I want you to lay on your side, facing me this way.
Facing you?
Yep.
I've had a lot of hip cracks. No hip is cracked in that position before.
No?
Not ever. I've had this one done quite a bit. Yeah, not the way you do it though.
Well, you know the thing is, and how I do all my adjustments, when I put a little bit of force in, if it doesn't want to move, I'm not going to force it.
Yeah, exactly.
You're that's kind of the way that you can injure someone. So that's why I do kind of a multiple of different techniques. I'm still hitting the same area, but one way might be
more effective.
Yep. Well, yeah, because you might not realize, but it might be easier for your body to just relax and let that adjustment go one way than another.
Sure.
Yep. Just like you said.
Yeah. I've had that done a lot, like I said. So and I get adjusted a lot. I do karate, so I get adjusted a lot.
Gotcha. Okay. And then let me have you lay on your back.
On my back. Good. Awesome.
Yeah, just want you to relax this leg for me. There we go.
Hey.
Those ankles released very well on both sides.
Awesome, yeah, especially this one again. That I felt that right up in my socket.
Good. Come on up.
Uh-huh.
And then come forward for me. Okay. Bring one arm up. Bring the other arm up here.
That one up here?
Yep. Take a deep breath in and out. Good. Already cleared.
Yeah.
And then you can let your hands just rest.
Uh-huh.
Okay. And now we're going to use that wide strap.
This is it.
So I know you've already told me you've had a technique similar to this done before.
Yeah.
So it's not going to be completely new for you, but
Oosh. Yep. That's it.
what did you feel?
Definitely not painful. Like I thought it might feel a bit of pain, but definitely none. But I felt it in my upper, not my lower. And it was just a nice deep crunch, almost like a knuckle. I wouldn't say a knuckle crunch, but it was felt like a good 7 or 8 vertebrae. My lower back, like I said, that one that you twisted me, I've had my hip twisted so many times and never felt a pop on the sides. It's always been more of a center twist pop.
Gotcha.
Like when you put me on the side, never on the sides. I've never had a pop on my side, and I've always had hip problems. So
Gotcha.
I'm hoping you really hit a good spot there, which I think you may have. Awesome.
All right, come up. So what we're gonna do? I want to use the massage gun again, relax everything, and then we're gonna do that Y strap one more time. So when I do the Y strap that second time, I pull at a little bit different of an angle. And then so you'll be able to tell me what you felt different.
Sure. Yeah.
Good.
One last word.
Whoosh.
And breathe.
It was nice. I felt that all up around here this time,
Okay.
around my neck. Yeah, that was more. They were smaller crunches, but lots of little smaller crunches.
Gotcha.
Yeah, it was really good.
Good.
Awesome.
Yes. See, I told you it'd be a little bit different than the first one.
What's the difference between the two techniques? What do they do?
That angle that I pull it on,
Uh-huh.
you know, I'll feel like with patients, you'll feel it more one areas than the other.
Uh-huh.
Yeah, just with the direction of that pull.
Uh-huh.
So I mean, granted, of course, you're going along that y-axis, so it's getting decompressed, getting pulled up.
Uh-huh.
But you know, like that first one, you know, I probably pulled about this angle. Second
Uh-huh.
one, I got down pretty low.
Uh-huh.
But yeah, just that line of that pull
Uh-huh.
can just change how it feels. But I mean, both times it didn't hurt you.
No, definitely no pain at all. Actually, a sense of relief after it happens too.
Okay.
So yeah, awesome. Thanks, sir.
You're welcome.
That-
Relax right here for me.
Uh-huh.
Yeah, we want to use this guy one more time.
Sure.
It's done.
Yeah, now Veronica, we'll have to book her in to come and... She was probably a bit nervous compared to me. But,
No, the thing is, when you watch the videos, it looks, you know, like it's a crazy type technique, but when you get it done, you're like, oh my gosh.
it's...
Like,
Yeah.
but, you know, it's not intended to hurt. Now, granted, it looks a little intense on YouTube and in the videos, but
It
it really isn't.
it definitely looks more intense than it is.
Also, a bit too much in the way of your cameras. I always try to.
Yeah, thanks so much for that. It was really good to be able to get like a
Full body type adjustment.
yeah, and also you know, I'm hoping to make a video from a client's point of view, because I've seen tons of videos from your point of view.
Yep.
So I've documented the whole trip on the way here, you know, talking about it, how I feel and what I'm experiencing. So
Nice.
yeah, I feel nice and relaxed.
Good.
It feels really good. Yeah, 100%.
Perfect. But yeah, this is how you should be feeling all the
Yeah.
time.
Yeah,
That's what I
great.
tell people.
Uh-huh.
You know, so many times people just, they experience pain and they live with pain and they just, oh, it's age, it's whatever issue going on, and
Uh-huh.
it's like, yes, I mean, age is a factor, things like that, but it
Mhm.
doesn't always mean you have to live in pain,
No, yeah.
you know, so.
Yeah, a lot of people, like you said, just think it's normal.
Correct.
And it's so not normal to be living in this thing. So like I said, I've had these injuries. I'm going to put that back on there. I've had these injuries for years, and to a point where I had them cracked and adjusted for a long time, and I really thought that you just can't get rid of them. They're just pain I've had forever.
That's what I had with my hip.
She has one like that, yeah. And I've got a friend who's quite young, and he walks everywhere like this, and he just thinks it's normal. I'm like, dude, you got to get that fixed.
Yeah.
That is not normal.
But you get frustrated because, I mean, I have an issue with my hip and I went to so many different places and you just spend each and every time $100, you know,
Yeah.
and you just think like, okay, nothing changed. Nobody seems to know what it is. I give up now and I don't feel pain only when I lie on hard surface.
Gotcha.
So now I just like, whatever, just don't lie on hard surface then.
Yeah, you just work your life around it.
Yeah.
Well, I've had hundreds of treatments before. That it really is the most. I feel like you hit the most spots than any other, and like everyone I go to do the same, you know, 5 or 6 moves for the most part. Whereas I actually feel like you've done a huge variety, especially the hips, and obviously the Y strap, but apart from that hip move is pretty magical.
Yeah. See, but that's the thing. Even like for someone like me, a lot of the times the traditional, like just a boom, like a quick neck crack, or, push on the back, get the thoracic moving, and then it's turn. For me, because I'm not really in pain, that works. That's all I need. But even like you were saying, you spend how many different visits to how many different professionals, and you're going from one office to another office to another office, and it's just money that you're paying, and you're not getting any relief, nothing's changing. So you begin to lose hope. And then it's like, okay, well, I guess I've got to either learn to live with it, then the worst are when it's, okay, well, now you need surgery. It's like, surgery on what? If you can't figure out and pinpoint telling me this is the issue.
Or they say it needs to be a long-term treatment. You need to come every week. And you just think like, but I need to feel at least improvement. If I don't feel anything, then you just think like, oh, well, I cannot come forever and nothing changes.
Sometimes it helps to have 2 or 3 appointments.
I guess, But you need to feel something, I think, at least within 3 sessions or so. But otherwise,
you do. You need to notice some kind of positive change. If not, then you're like, all right, well, why am I throwing this money away? Because that's what it almost technically comes down to.
And you got to try. The other thing, you got to try everything before you do surgery.
Correct.
Surgery is the last thing. So if you haven't done, put the camera on me for a second.
Sorry.
If you haven't tried a few good chiropractors before you do surgery, like it's madness. Like 99%. I've never had a problem with a chiropractor, and I've had tons of chiropractic appointments. I promise you. And a lot of people talk about having bad experience and not trusting chiropractors. I've had hundreds. I've had deep dry needling. I've done a bunch of things, and I've never had a problem. I'm not saying you don't, but you can have problems with any doctor of any kind.
Correct.
So you got to try everything before surgery. Most people have severe problems after trying surgery than anything else. So if you've got a problem with chiropractors,
and then it's probably harder for the chiropractor after surgery too, right?
A lot of the times after surgery has been done, there's nothing as a chiropractor. You don't even want to touch that area. Like, just say there was a fusion done. Now you can say, okay, I can adjust above that fusion or below that fusion, but it's like that's the main point of pain is where they have is right where the fusion is, and it's like, well, now what, you want me to take the liability to try to get you better, but you've already went and done the surgery, and
now you're playing with the landmine.
You can't. And you feel bad. Like me as a doctor, I feel bad as having to turn down some patients, or recommending them for a less aggressive type technique. Like might do better and respond better on a low force chiropractic technique, but in the end, you still got to watch out for yourself, and it's like you want to help everyone, but once you already have surgery done, there's not much
you can do, because it's a landmine, and you're going to be playing with sensitive areas, and then it's even more.
And then if something does happen, then it's okay. Well, now they're going to look back at the chiropractor. It was
exactly.
It wasn't the failed surgery on that. Now it's failed because the chiropractor touched it, and so that's going to clear the surgeon on anything. And now 100% is going to be put on the chiropractor. And
well, the chiropractor is the thing you do. First you start with a massage, then you get a bit deeper, then you get a bit deeper. I mean, I go straight to the chiropractor first because I know firsthand it works.
Because here you get a massage as well.
And you get a massage. Cool, awesome. Well, can't believe I'm meeting you in person. I can't believe I'm here. So thanks so much. I appreciate you allowing me to film as well. So
of course.
Cool. We'll let you go to the next one.
You guys have a good one.
Okay, just got back from Dr. Cipriano. Amazing. So what an experience in Greenville, South Carolina. So I felt it really down the top part of my back. I've had that done to me once before. Last time I felt it all the way down, right down to my lower back. But this time, or more recently, I've had my lower back adjusted quite a lot. And that last pull was about 5-6 months ago, maybe more. So I feel like that maybe just didn't need to be separated like my upper back did. But this time it was much more thorough. He did some other adjustments as well, like that hip adjustment. I have had the most off hips for ever. I've had my hips x-rayed a few times, and every chiropractor's all said, oh, your hips are off, your hips are off, your hips are off. I've never come across a chiropractor where I've felt the crack in the side of my hips. So this time I actually felt the crack in the side, which I didn't even think was possible. So I'm pretty excited. Last time I didn't notice a difference. Like today, since I did it a couple of hours ago, I felt firstly a tingle. Now I feel a bit red raw in the areas that he adjusted. But last time, that happened to me within a month. My back was just in bliss, and it's actually been in a really good position. So I didn't really need adjusting. Today was more about alignment for me. My back has gone from seriously bad, from slipping on steps where I jarred my hips about 12, 13 years ago, and I've had problems. Everybody that knows me personally knows that every 2 or 3 months I have to walk forward and hunched over. Since I've had that pull with the towel, not the Y strap, I haven't had it since. So I'm pretty confident that this works. But like I said, Dr. Cipriano is a little bit more thorough. He seems to know his stuff a bit more than the last doctor that I had did it. As a matter of fact, he's probably one of the best chiropractors I've experienced in terms of just feeling like he's done so many areas. Like when he did my neck, my upper back, my middle back, my lower back, and my hips. And even when he yanked my legs, he did it twice with 2 different methods. So he did sort of like holding my ankle forward and then holding my ankle back, which felt like it did different parts of my leg, which was pretty awesome as well. And I really felt it. Usually I feel it just in my knees or my ankles, but again I felt it right in my socket, in my hips, which is where most people have problems from, because we drive, we sit, we hunch over all the time. We're doing all these things. So hips are a serious problem, and lower back for most people, as you probably know. I'm not trying to sell Dr. Cipriano. I'd be happy to say that this guy was not right if it didn't feel right. But I just, after years of chiropractors, I feel great, and I'm super excited about how my body's going to unfold, how my body's going to respond to this adjustment in the next few weeks and months. So thanks, Dr. Cipriano. If you end up watching this, I really appreciate it. And yeah, awesome. Great episode. So stay tuned for more stuff about stuff. Peace.